we will discuss about anejaculation, the management. The management involves the non-surgical methods. Firstly, the pharmacological management with alpha-adrenergic agonist. Secondly, the neurostimulation, either with penile vibratory stimulation or electroejaculation. And then comes the surgical sperm retrieval, which we will discuss in another video. Firstly, penile vibratory stimulation. It is the first line of treatment for anejaculation in men with spinal cord injury. It involves placing a vibrator on the dorsum or frenulum of the glans penis. We should be careful not to place the vibrator on the shaft of the penis, as it can lead to injury. The mechanical stimulation produced by the vibrator recruits the ejaculatory reflex to induce ejaculation. This method is more effective in men with intact ejaculatory reflex. That is, men with a level of injury T10 or above compared to men with a level of injury T11 and below. In this image, we can see the Ferticare vibrator. So it is specifically engineered for ejaculation in men with spinal cord injury. We can see here the vibrator, how it is placed. It is placed on the dorsum or frenulum of the glans penis. Then comes the electroejaculation. Individuals who cannot reproduce the ejaculate by PVS. In those cases, electroejaculation is another option. Electroejaculation is performed with patient in the lateral decubitus position. A probe is placed in the rectum and electrodes on the probe are oriented anteriorly toward the prostrate and seminal vesicles. And then the current is delivered through the probe, which stimulates the nerves that lead to emission of the semen. We can see this in this image. Firstly, there is a continuous blood pressure monitoring. I will tell you why continuous blood pressure monitoring is done. Patient, we can see, is in lateral decubitus position. We can see here the rectal probe, which is in the rectum, and we can see the physician. He is delivering and monitoring the stimulation. He is delivering the current and monitoring the stimulation. We can see here one assistant who is milking the urethra to recover the semen. Now, why continuous blood pressure monitoring is done? Because there is a complication involved with these procedures. That is known as. So why blood pressure monitoring is very important when these procedures are carried out? Because of autonomic dysreflexia. What is autonomous dysreflexia? It is a risk for any method of sperm retrieval in patients with level of injury T6 and above. It is a potentially life-threatening medical complication resulting from uninhibited sympathetic reflex. So it is an uninhibited sympathetic reflex which leads to hypertension, bradycardia, sweating, chills and headaches. And sometimes this blood pressure can be as high as leading to stroke, seizures or even death. To prevent all these complications, nifedipine is administered by oral administration before these procedures are taken up. So we will come up in another videos with more related to more in male infertility, because that is less discussed topic. And till then, thank you for your patient listening.